Croeso cynnes I chi I ymuno ni heddiw yn ein cyfarfod ar gyfer yn elusen, cyfarfod ymddiriedolwyr yr elusen. Elusen byddwch chi'n adnabod fel awed las, mae'n debyg bod hynny yn y bwrdd iechyd neu yn gyhoeddus yn gyfarwydd ar gwaith ardderchog sy'n digwydd a'n bwriad ni heddiw ydy cael cyfarfod mwyn cydymffurfio wrth gwrs gyda'r angen I ni gael cyfarfod blynyddol ac edrych ar cyfrifion ac hefyd cael blas o'r gwaith mae'r elusen wedi cyflawni ar yn rhannu bob yn ystod y flwyddyn aeth heibio. Eitem gyntaf felly ydy unrhyw un eisiau datgan buddiant os gwelwch yn dda. Unrhyw un ar rywbeth I ddatgan? Na. Felly ymlaen yn ni at yr eitem nesaf sef cofnodion cyfarfod blaenorol o'r corff yma sef y cyfarfod y gynhaliwyd ar 30 o Ionawr 2025. Blwyddyn yn ôl bron. I pawb yn hapus I dderbyn y cofnodion yna. Diolch yn iawn. Ac yna yr eitem nesaf felly prif eitem ni ydy yr adroddiad blynyddol ar cyfrifon 2024-25. A be dwi am wneud ydy trosglwyddo'r awennau I Dyfed Jones sydd yn gadeirydd Pwyllgor elusennau sy'n cyfarfod dwi'n meddwl yn chwarterol ac yn gwneud y gwaith o y gorolwg yna o'r elusen a'r gwaith sy'n digwydd a felly dwi am drosglwyddo at Dyfed I gymryd yr awennau ac arwain ni trwy weddill yr eitemau os gwelwch yn dda. Diolch yn iawn.
Diolch Dyfed a diolch I bawb sydd yma neu sydd yn gwrando arna ni ar-lein. Mae'n bleser gallu cyflwyno yr adroddiad blynyddol ar cyfrifon I chi fel ymddiriedolwyr heddiw. Mae hwn yn dangos yr gwaith caled sy'n mynd I mewn I gynnal yr elusen a'r holl elfennau sydd yn nghlwm ar elusen. Mae Awyr Las yn edrych ar ôl 450 o wahanol botia o arian os da ni eisiau disgrifio nhw felly a mae heini yn perthyn I wahanol wardiau, wahanol wasanaethau o fewn y bwrdd iechyd. Ac mae hwn yn waith pwysig wrth gwrs edrych ar ôl y potiau hynny a cefnogi y rhai hynny sydd yn edrych ar eu holen nhw. Y rheolwyr darnau yna o arian. Felly dwi'n mynd I ddod â Neil I mewn yn maes o law I drafod yr elfen ariannol a mae Neil yn un o'r tîm yn elfen bwysig o'r tîm wrth gwrs yn edrych ar ôl yr ochr ariannol o'r elusen. Wedyn na I ddod â Neil I mewn I drafod hwnnw maes o law ond be dwi'n yn falch o allu wneud wrth edrych ar yr adroddiad yma, dwi'n gobeithio bod pawb wedi cael cyfle I gael cipolwg ar yr adroddiad, ydy y gwahaniaeth mae yr elusen y bwrdd iechyd yn wneud ar gyfer pobl Gogledd Cymru. Mae'r elusen wedi ariannu ystod eang o brosiectau gwahanol ac mae heini yn mynd I wella gofal a profiad y claf. Mae o hefyd yn gyrru gwahanol elfennau o'r bwrdd iechyd yn Saesneg innovation. Mae pobl yn ei glywed yr aml ond mae'n bwysig bod ni'n gallu cefnogi hynny. A hefyd mae o'n mynd I gefnogi datblygiad proffesiynol a lles staff y bwrdd iechyd hefyd. Felly mae o'n neud ystod o wahanol bethau. Mae o hefyd yn dod ar bobl yma sydd yn codi'r arian at ei gilydd. Ma' 'na gleifion dewr sydd yn cefnogi lot o weithgaredda ma' yr elusen yn ei wneud. Mae o'n cefnogi y teuluoedd a'r gwirfoddolwyr yna hefyd. Hefyd, mae'n bwysig cofio a nodi bod yn staff ni, boed nhw yn ddoctoriaid, bod nhw yn nyrsys, bod nhw'n staff cefnogol, yn gallu neud y defnydd na'r arian i neud rhai o'r gwelliannau hynny. Ac yn ystod y flwyddyn yma, da ni wedi gweld yr arian yn mynd i gefnogi pethau tebyg i therapia sy'n cefnogi cleifion canser. Mae'n bosib nodi, un o'r pethau eraill sy'n digwydd ydy, mae'r elusen yn cefnogi cynllun sy'n creu wigs ar gyfer pobl sy'n dioddef canser. Mae hwnnw'n yn gwneud gymaint i lesiant y bobl yna. Mae yna gynllun y celfyddydau mewn iechyd hefyd sy'n cefnogi pobl hefo dementia a hefo cyflyrau iechyd meddwl. Da ni wedi rhoi arian fel elusen i wella rhai o'r gofod clinigol mewn rhai ysbytai ac wedi ail-wneud ella a gwella llefydd ar gyfer rhieni pan maen nhw'n gorfod aros yn yr ysbyty o gwmpas wardiau ag ati. Da ni'n wneud pethau fel cadeiriau olwyn ychwanegol yn ein ysbytai i gefnogi cleifion, cadeiriau, doctorefn a felly. A mae rhywun yn meddwl mae hein yn mynd dipyn o ffordd i wneud y profiad o ddod i mewn i ysbyty neu i sefydliad iechyd yn well. Hefyd, gwella peirianna mewn ffordd, ultrasound, ECGs ag ati, just wneud siŵr bod y gwasanaeth yn gallu gweithio'n fwy effeithiol a bod ni'n gallu trin pobl falle'n gynt a bod ni'n gallu lleihau weithiau amser aros pobl. Wrth gwrs, dwi'n cadw hein, y ddau beth dola dwi'n mynd i sôn, sef y gwasanaethau gwirfoddolwyr sydd gennym ni yn yn ysbytai. Mae'n holl bwysig a mae yr arian yn dod drwy awyr las i gefnogi y gwirfoddolwyr hynny. Pobl da ni'n weld yn aml wrth drws ffrynt yr ysbyty sy'n croesawu pobl, sy'n rhoi cyngor i bobl pan maen nhw'n cyrraedd ysbyty. Mor bwysig i'r profiad. A hefyd, un o'r pethau pwysicaf, dwi'n falch iawn bod ni fel elusen yn cefnogi hwn, ydy, da ni yn cefnogi yr digwyddiad blynyddol sy'n digwydd yn fan hyn yn Fenyw Cymru sy'n dathlu yn staff ni a dathlu be maen nhw wedi gyflawni, a hefyd da ni yn cefnogi cynhadledd ar gyfer nyrsio a bydwreigaeth hefyd. A mae hyn yn bwysig bod ni'n cydnabod yn staff a bod ni'n gallu defnyddio'r arian i wneud hynny hefyd. Hefyd, da ni wedi cydweithio hefo elusennau eraill. Mae esiampl yn ddiweddar o waith yn Ysbyty Gwynedd o ran ward plant, lle mae yr elusen wedi cydweithio hefo elusen Gafel Llaw mwyn gwella yr adnoddau yn fanno. Felly, da ni'n gweld, mae pobl yn awchu i gael cefnogi yr elusen, oherwydd maen nhw'n gweld y gwahaniaeth mae o'n gallu wneud. Wedyn, dwi eisiau diolch i'r holl bobl yna sydd wedi cymryd yr amser i gefnogi'r elusen. Dwi eisiau diolch i'r aelod o staff hynny sydd yn cefnogi'r elusen ac yn gwneud siŵr bod yr elusen yma'n weledol a bod pobl yn gallu i chefnogi hi. Ac wedyn, mae'r ffigurau yn siarad dros di hunain mewn ffordd o ran lle yda ni o ran hynny. Mae'n bwysig nodi bod Archwilio Cymru wedi edrych ar y cyfrifon ac wedi rhoi, a dwi yn hoff iawn o'r term maen nhw'n ei ddefnyddio, sef a clean bill of health, sy'n addas iawn ar gyfer y cyfrifon, ar gyfer y cyfnod yma. Ond os na i drosglwyddo'n sydyn at Neil, a falla Neil felly di esbonio chydig bach am yr ffigurau sydd gennym ni ar yr adroddiad yn fan hyn.
Ie,
Diolch.
diolch Dafydd. Dwi wedi sylweddoli bod Russell di yn mynd ar call, so dwi'n gwybod os di Russell eisiau dod fewn yn gynta, neu dwi'n hapus i fynd trwy y ffigurau.
Ydy'n haws wneud yn ystafell?
Bosib neu...
Ie.
Hapus iawn, a Neil cyflwyno hun hefyd i'r byd ar betws gael gwybod pwy ti.
Iawn, oce.
Os di hyn Neil.
Reit, so Neil Williams ydw i, dwi'n un o'r tîm cyfrif yr bwrdd iechyd ac gyda cyfrifoldeb am paratoi yr cyfrifon yr elusen. So, ti eisiau fi fynd?
Ie.
So, na i newid i Saesneg rwan, just i fynd trwy'r ffigurau os ydy hynna'n okay. So, as Dyfed says, so the Audit Wales team have completed their audit and provided an unqualified audit report. In terms of the annual report and the accounts, so on page 31 of the annual report, there is the statement of financial activities, which just highlights some of the income and expenditure figures for the year. And it's a sort of sheer coincidence, really, that this year we've seen income levels of 2,316,000, which was exactly the same amount as last year. But as you'll notice in the report, the breakdown of where income come from this year was slightly different. We did see an increase in legacy income this year, up to £855,000, and legacies are a major source of income for the charity and equated to 37% of the total income during the year, which was the largest income source for the charity. And just in terms of putting some context around that, and obviously all legacies help make a significant difference to patient care, but the legacy gifts that we received during the year did range from £500 up to £200,000. So, there was a high value of legacies received during that financial year. Donations, they have been on a slight downward trend over the last few years, and that's a kind of national picture as well. That's reported by many charities, but they are our second highest source of income at 31%, and the value of general donations received in the year was 716,000, and a lot of those are made up of things like in-memory donations for loved ones who have received care from our services, and also from various community groups and organisations that choose to support the Health Board charity. One of those donations in the year was a significant donation from a local charity called Gafal Llaw, and they provided £85,000 for the refurbishment of the TN Vis parents accommodation at Ysbyty Gwynedd. Those works actually spanned the financial year, so there'll be some additional reporting on that in the 25-26 annual report next year. And the official reopening of that was held in November 25. So, sort of recognising thanks to all the various organisations and groups and individuals who donate to the charity. Other income streams that generate funds for the charity included obviously fundraising events and grants as well from other charitable organisations, and they made up 21% of the income at just below £500,000. And also we have investments with Brew and Dolphin, and I'll mention a little bit about those in a second. But dividend and interest income received from those investments was 261,000, being the remaining 11% of the income. The majority of the grants we received during the year related to ongoing projects, and David's touched on a couple of them there, things like the Arts in Health projects. And we've also received over the last few years quite a significant amount of funding from NHS charities together. And funding has been received from the likes of the Arts Council of Wales, WCVA, which is the Wales Council for Voluntary Action, and they're supporting projects which have been running for many years now across the Health Board. All sorts of different sort of fundraising activity took place during the year from our staff members of the public, and that sort of challenge events from sponsored walks, people running marathons, doing the Three Peaks challenges, bike rides, to various sort of other fundraising activities like cake sales and bingo nights. And we had a significant donation as well from the Llangollen Young Farmers Club, who did the annual illuminated tractor run in December 24. So that was a very generous donation from those. In terms of expenditure, so expenditure has been pretty consistent over the last few years. During 24-25, it was £1.8 million, which is slightly up on the previous year, and that was due to additional spending on charitable activity. David has already touched on some of the examples of that, but so purchasing goods and equipment to enhance patient care, and some of the services that have been supported include cardiology, cancer services, paediatrics, ophthalmology, and the refurbishment of T. Croes, our parents' accommodation at Ysbyty Glan-Clwyd as well. So, and some of that equipment, involves purchasing wheelchairs to transport the patients around our hospitals, comfortable and appropriate seating and furniture for patients and visitors. And as David says, it also extends to supporting staff development and research projects, which are based on funding applications that are submitted to the Charitable Funds Committee by members of the staff. So over the financial year, 29% of the expenditure was related to capital expenditure. So that's purchasing of equipment and also improving some of our facilities. 28% related to staff education and welfare, and 42% was on general patient care, supporting general patient care in all those various sort of ways that have been mentioned. In terms of the sort of fundraising, operational and administration costs, they were £58,000 lower in 24-25 than in the previous year, and that was due to lower staffing costs within the charity support team. The final parts of the statements of financial activities relate to the net gain on investments, which during 24-25 was £205,000. And that's dividend income and interest income received on cash balances and the investments that I mentioned earlier that are managed by Brewin Dolphin. So the overall net increase in the value of funds for 2024-25 was an increase of 721,000, and that increased our overall fund balances from 13.54 million at the 1st of April 24 to 14.26 million at 31st of March 2025. Continuing through the accounts onto page 33, which has the balance sheet at the 31st of March. And I won't go through every line, but you will see there the sort of value of investments that we had at the 31st of March. And with that increase in market value of those investments, and also the interest and dividend received during 2024-25, the value of our investments increased from 11 million to 11.4 million. Cash balances were also really healthy at 31st of March at 2.4 million, and they were up from 1.25 million the year before. And the reason for that increase was predominantly due to legacies being received during 24-25. Debtors decreased because there were lower legacies outstanding year on year, and creditor balances remained pretty stable from one year to the next. And the creditor balances relate to those ongoing charitable projects which span a number of years, or projects that have been approved via the Charitable Funds Committee, and it's just waiting for that expenditure to take place and for those items or services to be purchased. So the bottom of the balance sheet provides the breakdown of the funds into restricted and unrestricted funds. And restricted funds, as the word suggests, means that they are to support a specific location, for example, one of our hospitals or wards, or for a specific service area. And that's based on the donor's wishes in providing that income to us. So the value of restricted funds at 31st of March 2025 totaled £8.46 million, and unrestricted funds totaled £5.8 million. And although we have those unrestricted funds, the majority of those are actually designated for particular services or areas within the health board. I'm happy to sort of take any questions on any of those figures and also the remainder of the accounts that are included within the annual report documents. They obviously go on to talk a bit more detail, providing breakdowns and analysis of the income and expenditure of the assets and liabilities and of the fund balances, and also make reference to the accounting policies, etc. So yeah, happy if anybody would like to ask any more on those.
Diolch, Neil. Mae yna lot o wybodaeth yn yr adroddiad wrth gwrs a lot o fanylion o ran ffigurau yma sydd hyn i bobl fynd a gallu pori yn hwnnw yn ei hamser i hunan. O'n i jyst eisiau gorffan hefo cyfeirio at dau beth o ran yr datblygiadau sgynnon ni o fewn y tîm. Da ni wedi gweld newid yn y tîm, aelodau newydd yn dod i mewn i'r tîm. Mae'r pwyllgor ei hun yn aeddfedu hefyd o ran sut ydyn ni'n edrych ar ceisiadau sy'n dod i mewn ac yn gwneud y penderfyniadau ac yn edrych ar falla elfen fwy strategol weithiau o ran lle mae'r arian yn gallu cael ei wario mwyn cael y gorau allan o'r arian sy'n cael ei godi gan bobl ar gyfer yr elusen. A dwi'n gorffan efo un esiampl yna o dwi'n mynd i alw fo'n lori yn fan, ond y fan mae'r tîm cliw wedi gael here to help, y tîm awdioleg sydd yn gallu mynd â gwasanaethau allan i'r gymuned a gallu cyflawni lot mwy. Maen nhw'n gallu mynd i feysydd parcio, maen nhw'n gallu mynd i ganolfannau gwahanol sydd yn mynd â'r gwasanaeth at y bobl. A dwi'n meddwl i mi mae hwnna'n crisialu wedi gwerth yr arian elusennol yma sy'n dod i mewn. Mae'n gallu gwneud gwahaniaeth i bobl yn eu cymunedau, a mae pobl yn gallu gweld y gwahaniaeth yna sy'n cael ei wneud. Felly, ar ran y pwyllgor, da ni yn cyflwyno hwn wrth gwrs i chi heddiw fel yr ymddiriedolwyr i'w gymeradwyo fo wrth i ni symud ymlaen. Felly, efo hynny, mi wna i ddod yn ôl at ti, Dyfed. Diolch.
Ardderchog, diolch yn iawn, a diolch i Neil am tywys ni drwy'r cyfrifon a egluro ambell i bennawd. Diolch iawn am hynny. Do we am droi at Russ, just in case. Russell, you're online as Director of Finance and a person who has oversight of this work. Just checking in case you wish to add anything at this stage, please.
Yes, thank you, Chair. Apologies, I can't be with you as well in person, so hopefully you can hear me okay through the microphone. I guess only to add, the accounts were presented back through charitable funds, of course. We also had our Audit Wales colleagues with us who presented the findings of the audit. And I'd offer my thanks both to Audit Wales and to the team, and Neil, who's sitting in person, has just so adequately presented back through the detail of the accounts. I think some of the commentary from Audit Wales was around how we are working so well together and how the streamlining of the production of the accounts has worked really well. So my credit to Neil, the team, and also my thanks to Audit Wales colleagues as well, of course. We do need to endorse the accounts as trustees. The accounts need to be filed with the Charities Commission by 31st of January. So hence we are bringing it forward with a recommendation from Charitable Funds Panel for endorsement. I would just, on a slight note, just mention, Neil didn't mention those individuals who jumped out of aeroplanes on behalf of the House Board. A few people sent some invitations for me to jump out of an aeroplane, but that wasn't going to happen. So, but thanks to those who decided to do so. So there's lots of fundraising activities. And what I would also say is we appointed Bruin Delphin as our investment advisor moving forwards as well through a competitive tender process. And I'm pleased to say that today's date, the fund has risen to circa £12.5 million. So this is a significant amount of resource available to the Health Board to support enhancement in healthcare provision. We do want to embed this more within the opportunities for innovation. As David has already mentioned, we will be holding a workshop to understand how we better engage in terms of the wider development projects within the Health Board as well. So it's really just to allocate and identify those few things, and and offer my thanks to the team and of course the wider team within Audit Wales. Diolch, Chair.
Diolch yn iawn, Russell. Yes, I understand that there was difficulty getting any funds to supply you with a parachute, so for that.
That was exactly the worry.
So it's probably wise decision. Diolch yn iawn. Felly, cwestiynau neu sylwadau, cyfle I unrhyw un holi cyn I ni fynd I gymeradwyo a cyfrifon ar y adroddiad. Unrhyw un eisiau holi rhywbeth. Ian gynta, ti gynta, Ian.
Just gwneud sylw rili, faint mor braf oedd I weld bod yr elusen yn cyfnogi ambell I beth yn y gymuned yn ogystal ac mewn ysbyty. A dwi'n meddwl bod hwnna yn mynd I fod yn bwysicach yn dydi, tra bod ni'n symud tuag at cadw pobl yn iach tu allan I ysbytau. A felly dwi'n siŵr o Dyfed yn sôn falle fydd na ail edrych ar y strategaeth yn y dyfodol. A felly, dyn ni'n edrych ymlaen I weld sut mae hwnne yn datblygu. Diolch.
Pwynt da iawn, a jyst I ychwanegu at hynny, dyn ni'n hynod ddiolchgar am ymdrechion sydd ledled y gogledd o ran codi arian, fel mae ni wedi disgrifio ar amrywiaeth, ar amrediad yna. A be mae pobl yn deud wrtho I ydy, dyn ni eisiau gweld beth ydych chi'n neud efo'r arian. Na be mae pobl yn dweud. A dyn ni eisiau gweld pa wahaniaeth mae'n gwneud. Felly, dwi'n meddwl bod y cysylltiad yna rhwng y codi arian ac sut dyn ni'n busoddi o yn bwysig I ddangos fel ti'n deud. Paolo, ti nesa?
Ie, ni jyst eisiau adeiladu ar y pwynt o Dyfed a Ian di wneud amdan sut dyn ni'n defnyddio'r pres yn mwy strategol yn symud ymlaen. Sut dyn ni'n trio wneud hwnna yn y blwyddyn yma, a cael darn mwy o'r proses cynllunio. So, nawn ni weld sut mae hwnna'n dod trwy, ond yn dechrau'r blwyddyn meddwl amdan sut bydd ni'n defnyddio fo dros y blwyddyn I gyd, yn y lle cymryd just pobl gofyn am pres a wedyn wneud y dyfyniad dros hynna.
Na, pwynt da iawn. Rhywun arall cyn I mi ddod. Carol, just checkio. No, Carol.
Diolch Neil, thank you very much, and to everyone who's been involved with the charitable fund. I had a question really about unrestricted and designated, so sorry if it's a bit in my experience, there are certain parts of the healthcare system that attract more donations. And I always think, what about those that don't? And I just wondered whether there'd been much consideration of how we enable those that are less likely to attract those donations to benefit from those sort of unrestricted and those non-designated funds, and whether there are parts of our health system and health board that might deserve a bit more attention.
Yes.
Okay. Sure.
Dwi'n cytuno hefo Carol yma na'n amlwg, mae yna rhai elfenna o iechyd sydd yn, mae Carol yn iawn yn tueddu I gael lot mwy o gefnogaeth. Mae cancer yn un amlwg da ni'n weld. A mae yna resyma da dros hynny pam bod pobl ma agosatrwydd pobl at yn enwedig at y gwasanaeth a gofal maen nhw'n gael yn arbennig, a maen nhw bobl wedyn yn teimlo maen nhw eisiau rhoi rhywbeth yn ôl yn amlwg. Ond mae'n rhywbeth I ni fel pwyllgor I edrych ar sut da ni'n gallu dyrannu mwy o arian falla I ardaloedd yna sydd falla ddim yn cael. Ond fel mae Paolo wedi deud, mae hwnna yn gallu bod yn rhan o cynllunio o ran edrych ar lle mae'r angen mewn ffordd a lle allwn ni gefnogi chydig bach mwy weithiau.
Pwynt da iawn. Unrhyw un arall? Na, felly gai drwy gywn gyda ni. Russell ar-lein, eisiau dweud rhywbeth? Russell?
Yeah, diolch, Chair. Apologies, I'm not sure how I put my hand up on the Zoom model. So only really to answer, I think there's two things there as well. So how we rationalise, we've got 450 different funds under the umbrella charity. Funds that are restricted, of course, are restricted for purpose that the donator wishes. So we can't really repurpose those, but there's a significant amount of resource that is given without restriction. And looking at how we are using those funds and how many funds we have and pooling those for the greater good and major projects, as well as looking at how we can use that resource for areas that don't necessarily receive that level of donation directly. I think is a really good challenge for us to try and tackle through how we develop the strategic elements of utilisation of the funds as we move forwards. And that's all intrinsic to that workshop on the strategy for how we effectively model and utilise charitable funds as we go forwards.
Diolch yn iawn. Reit, dwi'n meddwl dyna ddiwedd y cwestiynau a cyfraniadau. Dyn ni'n symud felly i ofyn ydyn ni'n cymeradwyo y cyfrifon ar adroddiad blynyddol am y flwyddyn 2024-2025. Os gwelwch yn dda, mae wedi cael seil bendith Archwilio Cymru, wrth gwrs, a'r swyddogion perthnasol ydy pawb yn hapus y cymeradwyo ardderchog. Gadewch ni wneud hynny a diolch eto i bawb sydd wedi bod yn clwm ar gwaith. Mae Neil a tîm a Russell wedi gwneud gwaith ardderchog a wedi cydweithio gydag Archwilio Cymru yn dda iawn, felly dyn ni diolchgar iawn am hynny. Roeddwn ni wedi mynchu pwyllgor diweddar y pwyllgor yna, falle nid yn 2001 cyn hynny, ac oedd yn braf gweld y trafodaethau a'r ymdeimlad bod modd symud i le reit strategol o ran sut dyn ni'n defnyddio'r cronfeydd yma. Ond i orffen unwaith eto, i ni ategu'r diolch i bawb sydd wedi bod yn cefnogi'r elusen yn naill ai drwy teuluoedd neu drwy ymdrechion codi arian yn y gymuned. Dyn ni'n ddiolchgar iawn. Hefyd i'n staff ni sydd yn gwneud ymdrechion felly. Diolch i bawb, a dych chi wedi gweld rhwyth yr ymdrechion yna a'r gwahaniaeth mae'n gallu gwneud. Felly diolch y galon i bawb. Ni'n gwerthfawrogi pob punt sydd yn cael ei godi achos mae e'n gwneud gwahaniaeth. Reit, gyda hynny, dyn ni'n dod â'r cyfarfod i ben gan ddiolch i bawb am gefnogaeth ar gyfer y cyfarfod heddiw. Diolch yn fawr iawn.